Hello, this is Dr. Lewerenz, Longevity Health Institute, and yes, I have been missing in action a bit. Super busy, kind of good stuff and not good stuff in the sense of, but hey, beautiful weather, just like beautiful flowers. And what does that bring? Less COVID, less calls for the doc, so we can enjoy a little bit of the outdoors. But I wanted to review with you some stuff related to just some common things that I see all the time. And this is a video I haven't done, and I thought, hey, this is a great opportunity because it came across my desk today, and that is medical pitfalls or common medical mistakes or oversights. And these are simple things so that you as a patient, as who we're caring for and who you're seeing as a provider, a doctor, a nurse practitioner, a PA, a health coach, whatever, an advocate for you, that you don't fall through the cracks. Super key. So optimal, personalized, functional, and staying well is the base of keeping you optimal and well. So remember that. So these are common things. So I'm going to run through a few of these. I can't get into too much detail, but you can always send me a comment, always send me a message, whether it's Instagram, Facebook, or on our YouTube channel, and I will pay attention. I will respond. It just may not be super quick. Why? Because we got a pretty big practice, a lot of patients, and really dedicated to them, and they take priority. But I will tell you 100%, I will look at those and get back to you. So if there's something you want me to cover, something that you want me to extrapolate on, more than happy to. So again, medical pitfalls, common mistakes, and so that you don't get overseen or fall through the cracks. Very common thing is this, and everybody gets this in a doctor's office, whether it's a visit or the physical you get or whatever, is that you get a CBC drawn. It's a complete blood count. And in that, you're looking at your hemoglobin, your hematocrit, your platelets, and then what we call your differential, all your different types of white blood cells, okay? Now, real simple is this. It matters. If you have a repetitive, meaning more than once, low white blood count, okay? Let's say under 4,000, okay? Not once, but more, you get it rechecked because it's a little low. It's 3,200, or it's right at 4,000, or it's 2,800, okay? There's many reasons for that, but then you have to have the doctor or your provider or yourself pay attention and look at the differential. What is your neutrophils? What is your lymphocytes? What is your monocytes? Okay, what is your eosinophils? These give us directions into why that immunity, red flag, have you say, is off. Your white blood count has a lot to do with your immune system and your immune response, whether it's robust or whether it's sluggish and stagnant, okay? For anything. Again, cancers, infections, COVID, the flu, allergies, upper respiratory, blah, 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 blah. Okay, so these matter, okay? And when I see patients all the time, all over the place, no matter where you live and where you come from and all walks of life, okay, this gets very overlooked, okay? And it's checked all the time. So you want to make sure you pay attention to the differential, and a low white blood count is not acceptable. Again, if it's checked, if it's double checked 2-4 weeks later, to make sure, because there's little variations in it based on what's going on with you inside. And again, with a functional, personalized approach, we're always looking at your gut health and nutrients that are a big role into your white blood count, but is also is your gut lining, your bone marrow, and in certain nutrients. And there is some hereditary to it. Side note is African Americans that I see, and I actually saw one today with borderline, is that they're very common to have a little bit lower white blood count. And so you can take that into account. And that's just more statistical, okay? But your baseline and your metrics that you follow related to your white blood count are very key, and then in the differential, okay? Next thing is you have to, I've already reviewed this in another video, you have to check your iron count. And it's called ferritin. Okay, do not accept a lab if you're tired, especially if you're tired or you're suspecting a thyroid problem. Do not accept, if you have a lab done, that somebody's not checking ferritin. And I don't have the time to go into, there's another video on my YouTube channel about this, but it's super key is that ferritin is your iron store, and most of it's in your liver, okay? But if your ferritin is low, you are not carrying enough oxygen in your hemoglobin. It's what your oxygen attaches to in your hemoglobin. And yes, you don't have to be fully anemic, but you can still be very stagnant with energy. And also iron is a big feeder, okay, which is again checked in your store called ferritin to your thyroid. So your iron and ferritin status is very, very important, and it very gets overlooked. My optimal ranges I go for are about 50 to 100. Anything less than 35, you definitely have to consider supplementing it. And then you have to look at why, and you have to look at gut health, and you have to look at, a female menstruation or where you're potentially losing blood, like your colon or GI system. Again, another video, talk to your doctor or provider about that, but you gotta check ferritin, very often overlooked when you're fatigued. The other one is your B12 level. And the opposite is what you're gonna hear is, so serum B12, when it's drawn in your blood, often looks high. Now that can be what you ate that day, just in that day or that meal before you got to the doctor's office and we drew your blood, okay? And they're saying you're on too much B12. Doesn't mean that. You could be taking a multivitamin, you could have had a meal that's high in B12, and then you'll falsely be told you're on too much B12 and it's bad for you and all that. Well, first of all, B12 is water soluble. So it's not that bad for you. It excretes and all that. But your cellular volume, okay, your cell count of B12 inside the red blood cell is super key. And then that's where in the transport chain you get all the benefits of B12, okay? This is why B12 shots are very superior to any other form of B12 supplementation, because it goes right to blood, okay? The thing is, if you really suspect a low B12, you got to look at somebody's, it's called in their blood differential, their MCV. And it has to do with the red blood cell size. When our red blood cells are B12 deficient, they get macrocytic, they get bigger, okay? And that's measured in your MCV. So if your MCV is normal or potentially even high, your B12 level, really, you have to look at it as like, well, it doesn't mean much, because your serum B12 level could show high, and that's just floating around in your body, not inside the red blood cell. So you have to appreciate that, because one, you're probably not on too much B12. Two is you might not even have enough, yet you're being falsely told that your B12 level is too high or plenty, okay? So, and again, what is that gonna do? Well, that's how you methylate, that's how you detoxify. That is a lot of neurologic interactions in your body, over 200. And yes, energy. Yes, energy. As we age, what happens? Most of us develop an autoimmune response to B12 intrinsic factor. So it blocks gut B12 absorption. This is why sublingual and optimal levels of B12, and especially injections or sublingual, getting it into your bloodstream, are very key in why we all feel it. You get a B12 shot, if you're over 50, usually you feel it, okay? So very key, don't accept serum B12 as normal. If it's, not, if you have you gotta look at your MCV. The other thing is, especially if you're appreciating somebody's thyroid function, and I got a whole video on thyroid. I need to talk probably a lot more on thyroid because I get asked a million questions about thyroid all the time. And there's so many features to look at thyroid, but here's one that gets overlooked. If somebody has hypothyroidism, low thyroid, and if somebody has, treated with thyroid, but they're not getting the optimal results or not what you expect, okay? One of the things that's very common you have to look at is, one, you have to make sure your thyroid antibodies have been tested, fully tested. And the reason is to rule out or rule in Hashimoto's, a very, very common overlooked thyroiditis that is treated nutritionally with supplementation and dietary restrictions like gluten-free. Okay, very key, Hashimoto's have to be gluten-free. You will only thrive if you're gluten-free if you have Hashimoto's, okay? And Hashimoto's is very easily managed. And millions of patients go by year, not just my patients. It's data, there's data on this that get overlooked and undertreated and seen that they have Hashimoto's. So that has to be looked at. The other thing is, again, if you're not getting the thyroid expectancy with a treatment, okay, and you're taking thyroid medication, and or your levels are very, very low thyroid, you have to draw a lithium level, a natural lithium level. Now, lithium's in the ground, so it's in our root vegetables, it's in foods we eat, okay? So this doesn't mean necessarily supplementing lithium. Now, some people do supplement lithium for mood, for bipolar or depression, and it really can be effective in helping their mood elevation. But what's key is this: it can block your thyroid. It can block thyroid absorption. It can block your thyroid being optimal. So you have to check, even if you're not on thyroid medication or taking a lithium supplement, if you're not getting the results, you need to check a lithium level. It's very key to put that together, okay? The other thing I covered, I think in a whole video about this, but your lab reference range, really simple, is not normal range or optimal range, okay? Do not accept that. If you're feeling something and you're saying to your provider, your doctor, your practitioner, and I only preach this so you get the best of care, you get optimal care, the best of care and health, okay? You deserve it. You deserve it, okay? And your family deserves it, and your loved ones and your friends deserve it. Why? Because you will thrive, not just survive. You hear me say that all the time, but it's very real, okay? You deserve the best, okay? Look in the mirror and tell yourself that. Here's the thing is that if you're expecting to just fall in the reference range, that is the sick range. And as that statistically changes over the decades, okay, that means we're accepting people to be sicker and sicker and sicker, and that's the norm. I don't believe if you're watching this video that you want to be in the norm if the norm is sick. So think about that, but at least question the reference range. And think about whether that's normal, optimal, if that fits your symptoms. At least get a second opinion. Talk to a personalized medical physician or provider like we have here at Longevity Health Institute. And we have several here besides myself that are wonderful, trained under me, highly skilled, functionally, medically trained, hospital, ICU experience, you name it. My nurse practitioners and providers, as well as myself, have been around the block for a lot of years. So point being is, do not accept that, okay? The other one is, if you're checking lipids and you have any family history of cardiovascular disease, especially men, but men or women, okay? You have to check your lipoprotein A, or what we call LP(a). The reason is that's genetic. And even just today, this is why it's on my mind, I had a patient that has wonderful lipids, naturally wonderful lipids. I mean, I wish I had those lipids. I think their total was 180, their LDL was like 84. I mean, they're wonderful. No major healthy diet, but no vegan full diet, no drastic changes in their diet, nothing like that. Actually here to lose some weight and get healthier. But their lipids were fine, but their LP(a) was like 3 times the level of what it should. And that is a lipoprotein that's genetic. That means that their cholesterol is more clottable, okay? Now, it's difficult to treat. And there is some natural treatments, okay? And I'm sure in the future there'll be drugs to treat it, etc. But the appreciation has to be this. They have, remember I said, earlier cardiovascular disease in their family, especially men, and then they have this marker, and yet they get a lipid check, and their doctor's like, oh, your lipids are fine, your risks are low, you're good, have a nice day, see you next year for your physical. And they're actually at high risk unless they've had other cardiovascular screenings, like CT calcium scores or carotid intimal testing on their carotids or plaque testing. Things like this need to be assessed a little bit deeper because of that genetic marker, that lipoprotein on their lipid, and that is really, 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 really key, okay? And yes, it's not gonna be everybody, but it's those little people that fall through the cracks and they have cardiac events. This gentleman, actually, his father had his first heart attack at 52, and then he died at 64 of another massive heart attack. And it was, I can guarantee, it was never tested. And why do I know that? Is because he died about 2 decades ago, and we didn't even know about lipoprotein A, okay? So you gotta consider that, have that tested, tell your practitioner, your provider, your doctor, okay? LP(a). The other thing is this, going back to thyroid, never accept if you're fatigued or have any thyroid symptom, weight gain, cool temp, body temp, hair loss, drooping eyes, drooping mouth, eyebrow loss, nails cracking, again, fatigue, of course, poor cognition. The symptoms go on and on, but those are the big ones, okay? Low body temperature is a real big one. Weight gain, fatigue, brain fog, nails, okay? Never accept your TSH or your thyroid being normal at 3.5 or higher. The ranges now are ridiculous. 4s and 5s TSHs are considered normal. And most doctors, practitioners, unless they're looking at you in detail in a very, personalized approach, they will do a TSH as a screen alone. And you can, I see it here all the time, and you can have a TSH, people bring us labs from other providers, that is 4 and they say you're normal. They've never drawn T3, T4, total T3, free T3, thyroid antibodies, reverse T3. Now again, if your symptoms fit this, but you can't sit on a TSH, of higher than 3.5 and consider that to be, oh, I'm okay, I'm normal, especially if you have those symptoms, okay? Usually I like TSH, and again, just a very generalized comment, but around 2 to 3, or even potentially with Hashimoto's even less, okay, even lower. The other thing, big thing here, and this is supported by the American Academy of Cardiology, new recommendations, and I've been telling patients this for years, is this: you do not need to be fasting to come and get your cholesterol checked. And here's why. It makes no statistical cardiovascular difference whether you're fasting for your labs for cholesterol or not, okay? Makes no statistical cardiovascular significance. And again, this is backed up by the American Academy of Cardiology, American Heart Association, and that is very basic. Now, here's the thing is, yes, can you have a 30, 50, sometimes once in a while, 100-point rise in triglycerides? Yes. If somebody has high lipids, high cholesterol, but their triglycerides are astronomical, I don't know what word that is, but yes, being fasting makes a difference because their triglycerides can be a difference of 100 or 200 points sometimes. It's rare, but sometimes. But really, most patients do not need to be fasting to have their lipids checked, and that's been just supported again by the Cardiology Society. Now, sugars, prediabetes, and all that. Where do these people fall through the cracks? And how important is the epidemic, okay, quite maybe a pandemic, but literally, no joke, an epidemic in our country is insulin resistance, prediabetes, and diabetes. There is data out there now for years, multitude of studies showing that many patients, a third of our country, could be pre-diabetic and not even know it, which leads to early deaths, cardiovascular disease, earlier dementia, and besides poor quality of life and a lot of cost. I mean, we're talking billions of dollars in medical costs due to diabetes, unrecognition, undertreatment, underappreciation, undervalued, okay? And who suffers? You, because not only does it cost the government money, which then raises your taxes and your insurance, okay, but it's costing you and your quality of life, okay? So here's the thing is this. Every patient, if you get a blood sugar done, a fasting glucose done, that's what's kind of the standard of care. And if it's anywhere under 100 or 110, sometimes I even see 120, no provider, doctor, nurse, practitioner, PA, no one even blinks an eye, doesn't blink an eye. But you could have very high insulin fasting, and you could even have potentially average blood sugar high, hemoglobin A1C. So you have to appreciate and value these numbers, because really a fasting glucose is like saying, well, a phone's a phone. I'll take a flip phone. They work. Really? Well, decades later, they're way better. And we have way more sophisticated tests like fasting insulin and data to support that, and a hemoglobin A1C. So those should be checked, in my opinion, in every patient, because you will not fall through the cracks and then prediabetes, diabetes, insulin resistance, which not only cause all this disease, but also makes you gain weight. And you heard that right. When you gain weight, these things go up. But also as insulin spikes, you can gain weight easier. So part of losing weight is appreciating your insulin response and your glucose. And just because you're non-diabetic does not mean that you don't need these tests. You need those tests, okay? And don't accept just a fasting glucose as a screening test. That's my message. Yes, hopefully not too lengthy and wordy, but I hopefully brought to you a lot of real good info, bread and butter, so that you get the optimal care you deserve and need. Of course, we do this here at Longevity Health Institute daily. Me and my providers bringing you the best in functional integrative wellness medicine, and proud to and passionate and excited to. That's why I haven't made a video in a while, because just busy taking care of people, okay? So you guys have a wonderful day. Follow me and subscribe to this YouTube channel. Send me messages, please, questions, topics you'd like me to cover. We always take new patients, and we're open and actually hiring new practitioners, and even looking right now for a new doctor to join our robust team to bring you continued good care at every level possible, okay? And actually opening even another location in the near future. So this is Dr. Lewerenz, Longevity Health Institute. Be well.